Hi, my name is Dorothy Graham, and today I'm going to be discussing epilepsy and Western medicine treatments versus medical marijuana treatments. Now, we've all seen the articles and the videos on Facebook or YouTube where there are these people that are being treated with the CBD oils, the cannabis oils, whether it be oral or there's nasal sprays, and then they also apply it at the bottom of the feet. In these videos, you see these children or adults having these seizures, and in mid-seizure, they treat them with this oil, and it stops the seizures altogether. Now, of course, you hear all the hype about, oh, you know, marijuana is a better alternative, and it's going to work better than these medications that people and these doctors are prescribing to these people. Now, I'm going to start off with what epilepsy is. Now, epilepsy is a disease of the brain that makes people vulnerable to ongoing, unprovoked seizures, and the seizure itself is a disruption of the brain function where there's just too many electrical discharges being sent to the brain cells. Now, a lot of people can have seizures, but to be diagnosed with epilepsy, you need to have 2 or more unprovoked seizures in a day. Now, typically, doctors begin treating epilepsy with medication. According to the Mayo Foundation for Medical Education and Research, most people can become seizure-free just by using one type of medication. And some just, they might just decrease in the amount of seizures they have in a day or in a week, and still might have to continue the medication treatment. Now, there has been more than half of children documented with epilepsy who started the medications and eventually got to a point where they can decrease the medication and just stop taking it altogether and live the rest of their lives without seizures. Now, there are some side effects to taking medication, which includes fatigue, dizziness, weight gain, loss of bone density, skin rashes, loss of coordination, speech problems, memory or thinking problems. Of course, in rare cases, there's the depression and suicidal thoughts and actions. You also have a possibility of having inflammation in certain types of organs, specifically the liver. Not always the case, but it can happen. If medication doesn't work, they do have the option of surgery, sometimes not necessary. And then they also have the pacemaker that would go into the brain. It works very similar to the pacemaker that goes into your heart. If there's certain electrical discharges going off into the brain, it's going to send a signal and kind of counteracting it, and it's going to stop that seizure from happening. Of course, all types of medications and treatment options are different for everybody. Now, marijuana, aka cannabis, which is what doctors prefer to call it, is another treatment method that has been made public recently more, like I said at the beginning of the video. It's still a controversial topic, especially with medical professionals. There is, for those who are confused, there's a difference between marijuana and medical marijuana. When we're talking about marijuana, they are typically referring to the leaves and the flowers of the plant. When it comes to medical marijuana, they use the whole entire plant for medical purposes. There are cannabinoid receptors in the brain that receive the cannabinoid substances to which it can cause some effects. There are 2 different kinds of chemicals in marijuana. There's the THC, which gives you that psychoactive effect of getting high. There's also the cannabidiol, or CBD, which does not give you that getting high feeling, but it does have certain effects on certain body symptoms, and that could affect seizures. There is a drug derived from CBD and is made by
GW Pharmaceuticals, and the FDA has given some epilepsy centers permission to use it as compassionate use. Now I looked at the website Science Life, where they interviewed Dr. Michael Corman. He's the director of the Pediatric Epilepsy Program at the University of Chicago Medicine, who he's doing trials on epilepsy and medical marijuana. According to his studies, he did a study where there was 137 patients, and 50% of those patients were decreased by their seizures by 50%. Of course, the most common side effects of the cannabinoid oil is tiredness, increase in appetite, and in some cases, short-term memory loss. Now, Dr. Corman does state in the website that the hype of medical marijuana and its treatments towards seizures is a little bit of ahead of science, since there's such limits to how much they can study it because of federal regulations. They have limited access to it and can't really study it that much. And so, in conclusion, medical marijuana has shown promise to be a regular treatment option, but has yet to be proven to be a better option than the Western medicine treatments they provide. So, thank you.